hoping for too.
Right.
So, you know, ovarian rejuvenation isn't just for wanting a family.
Correct.
What are some of the other benefits that you've seen from ovarian rejuvenation?
It helps menopausal symptoms. So
Amazing.
women who are going through early menopause or in menopause, it helps those menopausal symptoms. It helps with libido. It helps with sleep. So we have women who come here just for ovarian rejuvenation, and they will do that every 6 months because it helps them feel better.
Wonderful.
And they're not trying to achieve pregnancy, but
or
help those
create
symptoms.
embryos. They're
Correct.
just wanting the benefits of the ovarian rejuvenation.
Mhm.
That's wonderful.
Yeah.
It's wonderful that we offer something that, and this is not something that every clinic offers.
Correct.
So we are getting patients from all over the country,
Mhm.
the world, to come here and do ovarian rejuvenation.
Yeah.
Now, for the patients that are doing ovarian rejuvenation to ultimately have a pregnancy, can they achieve pregnancy on their own after doing ovarian rejuvenation? Or is it only for IVF?
We've actually had a few patients who have conceived on their own,
Mhm.
and which is really exciting.
Yes.
But majority of them do need assistance of some kind.
Absolutely.
Yeah.
And it's nice because they get the boost, whether it's the quality of the eggs, whether it's the quantity of the follicles that are creating the eggs,
Mhm.
and they do get that boost.
Yes.
And then they are able to go into an IVF cycle and do a retrieval and create wonderful, wonderful embryos here
Mhm.
that we, you know, later will do PGS testing and get some more information about those, which is wonderful that we offer that.
Mhm.
Now, taking a step back from the treatment side,
Mhm.
we also offer something that's a little, you know, earlier on, which is egg freezing.
Correct.
Now, tell me a little bit about egg freezing and the importance of knowing about it early enough.
Egg freezing is kind of going through IVF
Yes.
just without creating the embryos.
Okay.
So it's, you know, for women who aren't ready to have children yet, who, you know, have landed their dream job and they want to, you know, build their career. It's for women who haven't found Mr. Right yet. It's giving women the power to choose what they want to do in their future. And so I love that because, I mean, when I was in school, I wasn't taught, oh, you can freeze your eggs.
No.
It was, you know, you get married, you have children, but egg freezing gives you that option.
It's the security.
Yeah, and you just get to do, you know, your goals. Not everybody wants to have a family right away, and that's, you know, great. And I think it's important that you're given that option because when you do, you know, reach your old, you know, when you're older and your egg quality is not the same, you don't produce as many follicles. We have women who say, I wish I knew about it.
Absolutely.
And there are so many patients of ours that, you know, wish that they were taught that when they were younger and that they had the opportunity to do it. So I'm glad that we do that with our patients and that women are doing that now.
I think it offers them a sense of freedom, a sense
Agreed.
of security, insurance. It's like I can have my future dream of having a family, and I can still accomplish all the goals that I set out for myself. And I think we're really fortunate and blessed here at Gen 5 to have such an amazing embryology team. Dr. Adams and Molly really pride themselves and work so hard at, you know, freezing the eggs. And
which is such a huge factor.
it is. And to have that experience, that I mean, to combine the both of them have 50 years plus experience of, you know, of embryology work, and they're perfectionists in the lab. They are. And
Which is the one place that it's the best to have
Yeah.
someone that's a perfectionist working on your little babies.
yeah, I just adore them. They truly are the best, and they are just as much as invested. You don't really see that always in a fertility center, but these two women are invested in our patients just as much.
Yes.
As we are, as Dr. Wood is.
Yeah.
And so, and I think egg freezing is a huge blessing for women who would not have had this otherwise, and know about it now. And I think it's becoming, you know,
more mainstream.
yeah, for women to do this for themselves.
Agreed. And I think just putting the power back, like you said, giving the power back to you and doing fertility on your timeline, not on, you know, women, we have a time, you know, it's like a clock that's ticking, and
pressure.
It's the pressure. It is the internal, our ovarian reserve of how many eggs are left and what the quality is. And you hear after 35, it goes down by the day, and all these kinds of things that you constantly hear. But then I guess you know, it's nice to know that you have that option. You can do this on your timeline when you're ready.
Yeah.
And you don't have to jump into creating embryos, because we have a wonderful team that can freeze your eggs and, you know, be waiting for you when you're ready.
When you're ready. Yeah.
Absolutely. And of course, at any point while we're talking, please feel free to ask any questions that you have on the chat box so that we can get to them towards the end of our little chat here. I get the questions live streamed, so we will be able to answer any questions that you have. If you'd like to do it privately, you can, or if you're open to doing it publicly, either way. Perfect. So where were we? We were talking about egg freezing.
Yeah.
The process is still the same as IVF, minus the fertilization part. So
And the
women
transfer.
and the transfer part. Women still do injection medication. They're taking hormones daily during their stimulation cycle, and that's pretty much the same. There's not much thing. Would you say there's anything else different?
No, it's still emotionally taxing at times.
Absolutely.
Yeah.
Absolutely. Because you're going through it. You're going through a retrieval, and that in and of itself is a process that you're going through. It's 2 weeks of injectable medication before that retrieval itself. You have the pre-treatment that's going to make you hormonal, and
Yes. It's scary.
Yeah.
And it, like Melissa said, it's emotional, but it's worth it.
Absolutely. Now, kind of jumping back to IVF and ovarian rejuvenation. When that path might not work, or that path might not be an option for some of our families. I know that Dr. Wood prides himself on being able to have everything under one roof. What are some of the options that they have after IVF?
So if after doing IVF and are not successful with using their own eggs, I love that we offer donor egg here at Gen 5. And we have a large donor egg option for patients. And I love the beauty of that for our patients, because, you know, many of them, you know, don't get to use their genetics, and that's okay. They have so much love to give, and they just want to have a family. And I love that we can offer that for them. That when all else, they've tried everything they can and still haven't been able to move forward, they have that option, and they get to create the family. And so we have a lot of women who have gone through that, and there's so much joy in them when they get to hold that baby and they've created that family. And so I love that option for them, and I love that we can do everything here, and they can select their donor, and a donor that they may feel, you know, kind of fits a little bit of them, maybe a little bit, and you know, create embryos, and then have the option to carry that pregnancy themselves,
and being involved in that process
from the very beginning.
Yeah.
From the very beginning.
And to be able to carry that pregnancy, and your blood and your body is helping to form this beautiful child. And you know, you get a small piece from someone, but you get to help create your own family. And
you're building a connection from the beginning.
Absolutely.
So I feel like sometimes, I know that's a hard hurdle for some patients to get over, that that's not my genetics. But once they know that, they're able to carry and create that connection and that bond, I think makes a huge difference for some of these women. So I think overall, once that has happened for them, and then they come to, you know, deliver and hold that baby in their arms, you know, it's all worth it.
It's all worth it. And it's all here. And they don't have to go somewhere else. I mean, there is not an outside clinic or lab or anything that they have to do outside of here,
Mhm.
whether it's the ovarian rejuvenation, whether it's the transfer, the donor herself will come here to this clinic, which I think is wonderful. And a part of the reason why I think we have such wonderful success is because the same physician that is doing the testing and the medical clearance on the donor is doing the retrieval, then helping Dr. Adams create those beautiful embryos. And he then is the same physician that's doing the transfer, which I think keeping the protocol aligned through the entire process just ensures that you're going to have such success. Now, there is also another option as well, which is surrogacy, which is not something that I think is widely spoken about yet, but it is an option that we have. Yeah. Do you want to tell us a little bit about maybe Marissa?
You know, actually, one thing we didn't talk about is donor embryo.
We did.
That
we
is
missed
another
the donor
option.
embryo.
Yeah, for our families who can't use their own genetics for, you know, period. We have donor embryos. I mean, there's families who created a lot of embryos and they've reached their desired family, and they're so generous to donate those embryos and give them life still. So I think that's a beautiful option.
It's an incredible option. And it's a lot quicker too, I would say. If you're ready and you'd like to move forward in a few weeks while you're getting your pre-treatment and your cycle coordinated, there's already an embryo sitting waiting for a transfer. And they either come PGS tested or without testing, but the ones that don't have testing, are we able to still test those embryos?
They can be tested if the patient wants to do that.
Okay, perfect.
Yeah.
Excellent. And then let's jump back to surrogacy.
Yeah.
Surrogacy is definitely an option for families.
Yes.
And what makes us different here? And why, why do we have surrogacy?
Well, surrogacy is for our women who physically can't carry their own child, and I think it's beautiful that there's women out there who can and are willing to help them. And what I love is we do have a surrogacy program here, and Dr. Wood, the perfectionist he is, sees them as well, and he makes sure that the surrogate is doing everything correctly, that it's exactly how he would want it to be done before he transfers that precious embryo.
Right.
Because, when I feel like when our patients aren't the ones able to do it, they kind of lose that control, and they're not able to do things how they would want to do it.
Right.
So I think because with Dr. Wood involved, it helps with the process.
Of course.
But yeah.
And again, just keeping the protocol aligned, having him be involved.
Yeah, and involved from everything. So these surrogates, go through a tough screening process, and he's involved in that as well. So his hand is in all things here at Gen 5. So they can't move forward unless he's
medically cleared them. Absolutely. And it's a process, not just the application process, but the actual screening process.
It is,
And so that the surrogate candidate that you're working with is someone that Dr. Wood approved.
Right.
And he wants the best.
Yeah.
And I think it's nice to know that the surrogates that are working with us are mothers themselves.
Correct.
So they treat this pregnancy as their own.
Yeah.
And they are wonderful. And they are empathetic, and they are not just doing this for the financial gain that they receive. They are doing this to help a family.
They really are. Yep.
And we get to experience that here.
We do.
So, outside of all of this, I know that we have a lot of really great updates on our Instagram account. And I know that we have some exciting news just from this past week.
Right.
Yeah.
So we've had, I mean, it's amazing to see some of these women who've done ovarian rejuvenation, who've done IVF. We've recently, as of today, we had a 50-year-old make a blast embryo, and it was a high-grade embryo, and she chose to do PGS testing, and we'll wait to see. And then we had last month a 49-year-old create a blast embryo, And
Oh my
I know,
goodness.
it's really exciting. And, you know, it has just given hope to women who have lost hope.
Absolutely.
And it's given a chance for women to do treatment who would have been turned away at any other center. But we're willing to say, we want to try. We want to try for you.
Absolutely.
If you want to do this, we are 100% going to do everything we can.
Absolutely.
And to be able to say, I want to try and then be successful, that's great.
Absolutely. Because I feel like a lot of women too are kind of pushed towards the donor egg route, maybe prematurely.
Yeah.
And then they don't answer that question of what if,
Right.
Exactly.
what if I would have done it,
Yeah.
right?
Yeah.
And what if I would have tried? And then, okay, I've done it. I know that it's either very close to being impossible or it's going to be very difficult and take a lot of time and strength and, you know, that, but I've given it a chance.
Yeah.
And now I know that donor egg is the right route.
I think everyone should have the opportunity to try.
Absolutely.
And, you know, be able to say, I gave it my best. And now I'm ready to move on to whatever the next step is.
Yes.
And
Absolutely.
then they don't ever have to second guess.
And think what if,
themselves.
because that can be a tough one to overcome.
Yeah.
Well, I am so glad that we were able to talk about this a little bit. You know, these were just some of the questions that we had prior to even jumping on, but I do see that we have a lot of really incredible questions that are popped up for us on the screen. So one of the questions that I think is a great question is the role of AMH in ovarian rejuvenation. Is AMH an indicator of whether it's successful or not? Is the goal to increase AMH, or is the goal more so for the embryos that you're creating? Can you tell us a little bit about that?
So even if you do ovarian rejuvenation, doesn't mean your AMH is going to change or go up.
Right.
It may stay the same. But what's more telling is what's seen on ultrasound. I have a patient who's currently 20 weeks pregnant, just turned 44, and did ovarian rejuvenation. She had one follicle, undetectable AMH, and one egg, made it to blast, one embryo, and it was normal. And she's graduated from our practice. And so if we would have just looked at AMH as
You may have given up.
Right, or she may have, you know.
She may have given up.
But she didn't, and she said she was going to keep pressing forward, and she did. And we're so grateful we did. Her first try, she was not successful. She had an abnormal embryo, but she tried one more time. She did 2 cycles with us. And I love that she didn't give up, and I love that she kept trying.
Absolutely.
Yeah. And again, so AMH, yes, it's a good reference, but it's not always the end all.
Yeah.
Absolutely.
And that's a lot of women think that, oh, I did the procedure. Why didn't my AMH go up? It doesn't always, like she said, it's not going to always go up. That's not an indicator. Ultrasound is a good indicator. Also, after we do an egg retrieval, looking at the egg quality is a good indicator, because that's ultimately what ovarian rejuvenation is helping with, is egg quality. We're trying to create beautiful embryos.
Normal. Yes.
And AMH isn't always going to go up. I have had patients whose AMH has gone up and they did great. I've had AMHs that have just stayed the same and they did great. So it just depends.
So not focusing too much on the AMH, looking more at the AFC, looking at the follicle count, looking at the quality of the embryos that you're creating after. Now, let's say that they've done the ovarian rejuvenation, whether it's PRP, NPLAF, or Ultra, or Generation 4. Whether they've kind of done that, what's the time frame between doing ovarian rejuvenation and then jumping into an IVF cycle?
It depends on hormone levels. So when we have patients coming in for ovarian rejuvenation, they get their hormone levels drawn, and we look at those hormone levels and determine when they're ready to start. And typically, Dr. Wood wants to start them between 3 and 4 weeks post procedure.
Right.
But it could change. I mean, we tailor everything here to patients' hormone levels, to them specifically.
Right.
There is no route A, route B, route C. We look at everything.
And I love that because it's different for everyone.
Mm-hmm.
And so it's important to be flexible on that and create a specialized path. And I think that's something that you both are very perfectionists on, is making sure that you create the right path for each family. And if they have an unsuccessful cycle, what went wrong? Let's sit and talk about it, and let's fix it the next time.
Yeah. What can we do different?
Right.
What, you know, what medications can be done differently?
Right.
You know, what monitoring can be done differently? We look at those things again. We review with Dr. Wood.
And even we even review them with the embryologist as well. Dr.
Right.
Adams, she is a perfectionist. She's very involved. So if, for example, if one of her cases didn't go as what we hoped for, we all sit down and think about how we can do better the next time.
Right. Right. It's important to do.
Yeah.
And even when it's successful, thinking about, okay, what did we do right? And let's keep doing that.
Yeah.
So we talked a little bit about the different types of ovarian rejuvenation. Can you maybe bounce between the three and tell us a little bit about, just give us a quick synopsis about the three and what the difference is between them?
So generation 1 PRP is just platelet-rich plasma, and those are typically we do that again for a couple of reasons. PRP is used a lot in menopausal symptoms, patients being treated for menopausal symptoms, because it helps with different things other than trying to do fertility. For some, they may choose PRP because it has a little bit of a longer lasting effect. And depending on the type of treatment plan they're seeking, they may do PRP. MPLAF is more growth factors that are being injected into the ovary. And so that tends to be done for patients who are going to go right into an IVF cycle shortly thereafter. And Ultra is a combination of the two. And so that might be more for women who are looking at doing maybe a few cycles right after another.
Wonderful. Well, I really, again, do, as always, appreciate you both hopping on here. Not only do you spend all day with us, but we get to have you here on a, Thursday night? Thursday night.
Well, and then Marissa wanted to share
Absolutely. Well, we have something exciting that's kind of launching here. Marissa, if you could share a little bit.
Yeah, so I love my patients, and I know Melissa does too. And we care about them so much that, a lot of them we know are going through an emotional journey, and we want to make sure that they are getting, the support that they need, the help that they need. So we are launching our IVF BFF. I know we kind of talked about it before a couple months ago, but we're going to launch it, and we are going to hold monthly meetings here at Gen 5 or get-togethers where, women who are going through this process can all come together and talk about, or they don't have to talk about it. They can just talk about life, period.
Yeah.
Just so that they know they're not alone. I know we know there's a lot of women who struggle with infertility.
Absolutely.
And that are going through the same process. And I think we should all, be there for each other and,
I agree.
Build friendship. So.
And this is a support group that many patients have asked about. And,
right.
Because they don't have anyone outside the home to talk about. And it would be a great way for them to make some connections, know that they're not alone. And we love that we get to be with them a little bit longer.
Yeah.
We get to be there and be part of that support with them.
Absolutely.
Because Marissa's right. We genuinely love our patients, and there's nothing that brings us more joy than to see them graduate from our office. So,
absolutely. Even though we're sad when they leave, but we're excited that they're getting to graduation.
Yes.
And they're getting to go to an OB.
Yeah.
And we wait for those beautiful baby pictures.
We do.
We do.
We look forward to those.
We sometimes set the reminders, our notifications, to circle back with you.
But
I appreciate you guys coming in. We answered a few of your questions live here, but we didn't get to all of them. One of the benefits is that we will get to them on the Facebook group. So we're going to sit, we're going to chat, we're going to talk all things fertility, anything you need, we're going to be there to support you. Melissa and Marissa are incredible, and they kind of run the show here. And again, we are so lucky to have you both. And one special thing that we didn't talk about yet is that there is a giveaway in tonight's IVF BFF. So we didn't advertise it. We just wanted this to be a special little something that we did for those that showed up. So we are going to go ahead and announce the winner privately, because of course, you know, we don't want to put any names out there, but we will contact the winner. It's going to be a random winner, and go ahead and give you a little gift basket from Gen 5 just for tuning in. But again, thank you guys so much for tuning in. And you know, if you need any of us, we're always here for you, and we're going to be here for you on Facebook now as well. So we look forward to seeing you guys there. And don't forget to sign up for our IVF BFF Facebook group. And again, we look forward to working with you soon. Thank you all so much. Have a good night. Bye.